Hello, my name is Newton Masi from Grace and Favor Ministries. Today we're going to talk about a topic that has been of concern and is still a concern, not only in Uganda but the world at large. And today we have with us a community rehabilitator. She's going to introduce herself and she's going to briefly talk about mental health. You are welcome.
Thank you, Mercy.
Introduce yourself briefly to people want to know who you are.
Okay, my name's Nakiria Marion Mukoli. I'm married and a professional community-based rehabilitator.
Yes.
Yeah.
So as a rehabilitator, actually before we go into rehabilitation, what is rehabilitation?
Thank you, Mercy. Rehabilitation is a process of assessment, treatment, intervention, and management by individuals to attain their full potential.
Yeah. So if we want to know more about rehabilitation, what would you just give us a brief description of what is involved in rehabilitation? What people do you deal with and all these things?
With rehabilitation, since it's about attaining someone's full potential and function, it's more of about disabilities, working with persons with disabilities. Yeah, different kinds of disabilities. It could be mentally, physically, emotionally, yeah, all that.
You've hinted about something that we are very interested about.
Yes, please.
So you've talked about mental disability, and today we want to know, in the perspective of rehabilitation, what is mental health?
Thank you, Mercy. Mental health is a state where one is spiritually, physically, emotionally, and psychologically stable, where one's mind is stable.
Yes. So when can one regard themselves unstable?
Thank you. One can regard him or herself mentally unstable through a number of things. One could be going through what we call anxiety. And with anxiety, this is a state where one is going through a sorrowful or worrying station or state, fearful. They could be tired, restless. Yeah. And for example, there are situations where people do not understand that they are actually going through anxiety, but when it's the truth and it's happening, a person can be feeling like is getting mentally ill.
So you mean
having
they can actually feel it?
They can actually feel it, but they do not know what exactly is happening to them.
Okay.
You get it? So in such situations, a person becomes more fearful, more worrying, what is happening to my life? You get it?
Yeah. So before this, I was making some research because I didn't want to seem like I didn't know anything. So I was making some research, and there is a report in KFF Health Portal that says 4 in 10 people have a problem of mental health, have a mental health disorder. And it triggered my thinking, it triggered my mind. I was wondering, what is anxiety, what is depression? And you've explained anxiety. But then, what is depression? What are other forms of mental instability?
Like
you can talk about the common ones at least.
Like you've already mentioned, depression is part of it. It's one of the mental disorders, mental issues. And with the depression, it's a state where one's mood is either elevated or is at a low mode. You get it? And with the depression, there is what we call also clinical depression.
Yes.
With clinical depression, it's a situation where there is persistent increased depression mood or low interest, where one fails to participate in certain activities.
You get it? Yes. So I'm just wondering, does it mean that every person who is low, who is sad, does it mean they're actually going through depression? When does it become a disorder?
Actually, it becomes a disorder when someone goes through excessive sorrow. Too much of it becomes a disorder. And in case this person fails to get a solution or to, there are certain levels where a person is going to recover, but once they go beyond the recovery level, then it's considered a disorder.
Okay.
So in case a person gets quick solution and they recover, that's well and good, but once they go beyond it, then that becomes a disorder.
Okay. So what is the reinstated time for recovery? For example, if I lose my mother, or if I lose my mother, God forbid, what is as a rehabilitator, what is the recommended time that, okay, if the person goes beyond this period, then this is a disorder, or if they are within this period, it's not. What is your view about that?
Okay, there are levels of depression depending on what someone went through, depending on the cause of what has brought about depression. I'll give my example.
Okay.
In some years back, I lost a sister, and it brought a lot of trauma because I watched her breathe her last on bed. Yeah, it brought too much trauma and too much pain, to the extent that I could not contain the pain anymore. I felt like this is the end of me. It's the end of the world. And in such situations, I lost concentration, especially at work. I could not concentrate. Whenever I would reach office, the only thing would be reflecting my mind would be what she went through, what I saw, the pain she went through, and I would imagine how will I stay without this person anymore, because she was my close friend. So in such a situation, I reached a point where I felt I can't handle anymore, and I thought, actually I sought help from a friend. I opened up to a friend, and this friend was of help to me. How? She counseled me, she prayed for me, and she encouraged me to socialize more with friends, or doing more of outings with others, and then moving away from things that can bring about those memories of her death. And that helped me to recover from such kind of depression.
Thank you so much, Marian. Actually, you've helped me understand that when I am depressed, I have to seek out for counseling. But are there any other interventions I can actually go for? For example, if I know, if yes, you've explained what depression is, and now I know I'm depressed, what would you advise me to do as a rehabilitator after finding out all these things? What would you advise me to do, the first steps at least?
Okay, thank you, Mercy. The first step would be, if you're going through, for example, anxiety, I would encourage, first of all, sometimes someone does not understand that they're going through an anxiety. But now that we've created awareness, you have to understand what anxiety is. When you see you're experiencing such things, then seek for help. You can open up to someone, a friend, a relative, or someone who is close to you, that you're free with, to open up to how you're feeling. And in such situations, this person can guide you on how to go. You'd either seek medical attention, or counseling that can help you bring back your full potential.
Okay.
Yes.
Okay. So with examples, because there's something I didn't understand. Anxiety is something that is misunderstood very many times. I can be here and I'm anxious, and it's something that we have actually adopted in our everyday lives. So give an example of a scenario of anxiety, and help us understand more about anxiety as a disorder.
Okay. Actually, there's a client who once came to us seeking for help. And this client was going through anxiety, but he did not know that he was going through anxiety for some good time. Actually, to him, he explains it was close to 2 years that he was experiencing such a situation. So at one point, he felt he was becoming mentally ill. Whenever he would be moving on the road, he would hear voices in his mind, and he felt something was not right. So in such a situation, he had to seek for
medical attention.
He had to seek for help he asked someone what he was going through. Good enough, the person he asked at the rehabilitation center was a person who had an idea or knowledge about anxiety, and this person helped him. How? First of all, she encouraged the client to seek medical attention by getting some pills to help him. After that, he was also counseled. How? He was told to do more of going for outings and then having enough sleep or enough rest, to getting away from the source that was always causing that anxiety in his life.
Okay, okay, thank you. So aside from anxiety and depression, there's something else that I have been hearing. We've had it over the news, we've had it very many areas, and some of us, I didn't know why it was an issue. But I want you to explain something about suicide. Can we also put suicide under mental instability? What would you say? What is your view about suicide? Is it a mental disability? Is it something normal? Is it spiritual? Just briefly take us
Thank
through
you,
that.
Mercy. Suicide is it's also a mental disability. As a rehabilitator, it's a mental disability. How? This is a situation where one is having too much or excessive feelings about death. They wish they have died. They wish they died. They wish they were not born. Yeah? And such situations are caused by a number of issues. Such thoughts of suicide are caused by a number of issues. Maybe someone is being accused of something that he did not do, something so big. Someone comes and accuses you of something that you've not done, and everyone is against you. You feel the whole world has left you. So in such a situation, the only option someone can think of is maybe I commit suicide, since now everyone hates me. And since that one lowers your self-esteem, it now leads you to something else that is negative, and in most cases such people end up committing suicide.
It's painful. So how do I know, for example, if I'm going through suicide or if I'm going through a phase of suicidal thoughts, like you've explained, how do I know that now I'm going through an episode of suicidal thoughts? Or if I want to maybe help someone, how do I know and how do I help them? Okay.
Like I said before, how do you know that this person is actually about to commit suicide?
Yes, what are the symptoms?
One of the symptoms, these people will always be talking about death. You'll hear someone say, I wish I'm dead. I wish I was not born. I wish everything just ends now. Just know something is not right. Don't just look on things and leave it there. Always know something is not right with this person. And at times, they will start giving out their belongings. Or if not, such people will become so violent, or even get engaged in drug abuse. You get it? So because they feel life is no longer useful to them, so they end up doing things that don't matter anymore in their lives. So when you see such kind of things, just know something is not right with such a person.
Okay.
Sometimes they will even make their wish. You get it? When I die, A, B, C, D should happen. Always put question marks on such statements that a person makes.
Okay. So how do you help such a person?
First of all, such kind of people, they usually don't open up. They are so silent and quiet because they know what their aim is to commit suicide. So usually they become silent and isolate from people. They stay on their own. They don't more isolate with others. But if you try to identify such kind of things, maybe if it's a brother or a sister in the home, try to look out to someone who is bigger, call, tell the parent or a guardian, so and so is trying to mention such statements. How do we help? Maybe he's trying to commit what? Suicide, or he will want to what? To commit suicide. So if this big person really understands, they must bring a solution. How? They either take this person to a rehabilitation center or look for a counselor around to first counsel and find out a reason as to why so and so is mentioning such things. Because in most cases, such kind of people, they have run out of help. They feel there's no help that can help them. They feel there's nothing that can bring back their real them. Yes.
Okay, about suicide, I cannot say much. You've explained most of it. So there is another issue. I think you've talked about it also. So just give a brief conclusion of whatever we've talked about and what you as a rehabilitator would advise. What advice or what, just give some final words for the people watching this today.
Okay, thank you so much, Mercy. And in my conclusion, I would encourage everyone outside there that has heard what we have discussed here about mental health. We believe we've created some awareness about what people go through that creates or brings about mental disability in people's lives. So, in case you see or know anyone who is going through such kind of disabilities or disorders that we've talked about, kindly seek help or run out to a medical center or a rehabilitation center and get quick help.
Thank you very much, Marion.
Welcome.
Thank you very much for watching this segment as we have gone deeper and we related rehabilitation to mental health. If you are out there and are going through a challenge similar to what she has mentioned, you can reach out to our YouTube channel, you can reach out to us on Facebook, Instagram, you can even reach out on our website at www.graceandfavor.org, and on YouTube you can find us at Grace and Favor Ministries. On Facebook we are Grace and Favor Ministries, and then on Instagram Grace and Favor Ministries. So just write out your problem and we'll be able to reach out to you wherever you are. Thank you. Thank you for watching. Today we're mainly talking about mental health in the rehabilitation perspective. Tune in next time. We're going to know more about mental health. We're going to bring in very many more people to explain some other issues. I know very many of you have many more concerns, but tune in for the next segment.